The Homeless Community and Hypertension. Amy Roberts, Health Education Project Number 1, Nursing Course 444, Professor White, LPN to BSN Nursing Program at Indiana State University. This presentation is about the homeless community and high blood pressure. Being homeless does not mean one will have high blood pressure or vice versa. The homeless community is at a disadvantage for not having many resources or available health care. Many homeless people go underdiagnosed with medical conditions and have a higher rate of premature death. It is important to include the homeless community because they are human beings like us. They should not be discarded due to their living situation. There's a lot more to a homeless person. Learning objectives. There will be a pre-test and post-test given at the beginning and the end of this presentation. Understanding the values of blood pressure. What it means to be vulnerable in the homeless community. New Haven, Connecticut. Community health care vans are mobile medical clinics. What is the Patient Protection and Affordable Care Act of 2010? Tips for lowering blood pressure and online resources at the end. Population at risk, the homeless community. Please hit pause and take the pre-test. When you are finished, hit resume to continue with the presentation. Blood pressure values. Normal values. Systolic, the top number, is less than 120, and the diastolic, which is the bottom number, is less than 80. Elevated values. Systolic, the top number, should be between 120 and 129, and the diastolic, which is the bottom number, should be less than 80. High blood pressure values. Systolic, which is the top number, should be 130 plus, and the diastolic, the bottom number, is greater than 80. It should be noted, one is not diagnosed based on one reading of an elevated or high blood pressure. If a person smokes cigarettes, vapes, drinks alcohol, does illicit drugs, overweight, or has underlying medical conditions, they are likely to have increased risk factors for high blood pressure. The homeless community is vulnerable and has many disadvantages. Some people may think homeless people are lazy or incompetent. It's important to realize they were once like the general population and have succumbed to addiction, mental disorders, trauma, or disabilities. The homeless community has a higher mortality rate by 4.5 to nearly 10 times than the public. Mental disorders increase one's risk of smoking. Some see smoking as a coping tool and are not aware of the effects of it on their overall health. Mental disorders like depression and anxiety, post-traumatic and stress disorder, and stress affect blood pressure. Homeless females have similar risk factors for high blood pressure like homeless men. However, anemia, chronic obstructive pulmonary disorder, and mental disorders are included. Population at risk, homeless community. Did you know New Haven, Connecticut has the highest income per capita in the United States, as well as the poorest population per capita? The community health care van is a mobile medical clinic that was created nearly 30 years ago to help their homeless community in New Haven. Their purpose is to serve the underserved. Pretty simple. More than 1,500 mobile medical clinics are across the United States. They are operated by hospitals, universities, and nonprofit organizations that provide, prevent, diagnostic, and treatment services. The mobile medical clinics are used as triage centers to provide acute care in the community. They are not used for a person's only source of health care. The mobile medical clinics service homeless communities, underinsured, poverty-stricken people, and as well as poverty-related differences such as high rates of unemployment, crime, addictions, and recurrent incarceration. Their services are free, and it depends on the care that is needed to treat high blood pressure for the homeless patient. A referral can be made to a specialized community-based health care. Some homeless patients with high blood pressure visit the community health care van only one time before they are referred out. It should be also noted the specialized community-based program healthcare utilizes social services to help improve their health outcomes. These organizations aid in providing housing, help with substance abuse, and behavioral health. Population at risk, the homeless community. What is the Patient Protection and Affordable Care Act of 2010? President Obama signed the Patient Protection and Affordable Care Act in 2010. It is offered to all Americans. It gives the people new rights and protections that make coverage affordable, easier to understand, improved health care while lowering costs of care. The homeless community may receive health care with the Affordable Care Act. How is it possible for a homeless person to afford care? The Affordable Care Act allows a homeless person to apply for health care through Medicaid. It is a process, but it can be done. The Affordable Care Act focuses on outcomes and values of healthcare by treating the whole person, not just procedures and volume. This can bridge a gap between healthcare and other needs like social services and housing. While most of the process of obtaining coverage is done online, there are 1,150 community health centers across the United States that offer face-to-face, live in-person help with the applications and navigation through the Medicaid application process. Tips for lowering blood pressure. Quit smoking or vaping, reduce sodium intake, avoid stress, maintain a healthy weight, and be active. How can a homeless person do the tips mentioned above, especially if they have a mental disorder or other barriers to prevent them from doing so? As mentioned before, a referral may be given due to a homeless patient with high blood pressure. Online resources for high blood pressure listed below. Every state has their own type of resource that are available for their own homeless community. It should be noted not all homeless people or homeless communities live close by to these resources or have any type of transportation to these mobile clinics. Washington State websites are listed below because I live in Washington State and believe our community can pull together to help our fellow man and woman. Please take the post test. Thank you.